All right, this is Dr. Dawn Sears, Gut Girl MD, and I'm coming to you with one of my friends, Dr. Adam Harrison. He has an interesting background. He's not only a physician, originally trained in the UK, also a lawyer and an executive coach who specializes in bullying. Whether you are the bullier or the bullyee, he may be able to help you with his coaching practice. So thanks so much, Adam, for being with us tonight.
Oh, thanks so much for having me, Dawn. It's a pleasure. Thank you.
So we know the bully on the playground, and we know that obnoxious surgeon who's throwing scalpels and yelling at people and calling people names. What is the middle ground where you actually see a lot of your clients? What kind of behaviors do you notice?
Well, there's sort of really overt stuff, like things that I've experienced and a lot of us have experienced as doctors. In fact, the statistics are quite frightening. It's a large portion of us, where we've been bawled out in front of our colleagues on the ward or in front of patients or in theatre, as you say, or instruments have been thrown. Certainly, I haven't had a scalpel fly in my direction, thankfully, but I've heard of it happening. This was probably in the early 2000s. But yeah, I mean, the majority of it is, kind of shouting out, belittling, shaming, kind of stems, I think, from those days of teaching by humiliation. We presume it was the same in the States. If you at the bedside when you're a clinical student and if you got something wrong, then the dinosaur of a consultant or attending, as you guys call them, would have just barked at you and really shamed you in front of others. And I think that's part of that that bygone era. Somebody's still sort of like lingering on. I mean, I guess people of a certain generation have modeled themselves on that type of person, so it's being perpetuated and propagated still. But then there's also the more insidious stuff, the sort of microaggressions and casual discrimination and things like that goes on. But it's equally important, and it may not have that kind of major psychological impact that someone, shouting and screaming in your face does. But, I've heard it called death by 1,000 cuts. So, if you're regularly experiencing those sorts of, casual racism or other microaggressions, misogyny and things, then it will just get to you. And like with other forms of bullying, it will lead people to become very depressed and perhaps even suicidal. So,
right.
And I thankfully haven't had suicidal doctors that I've worked with, and it's not my forte anyway. I would obviously signpost them to an appropriate specialist, but I know it goes on a lot. So
right. So you mentioned misogyny and harassment based on gender and race and maybe religion and other things. Yeah. What would you say is the often demographic that you're seeing for the bullier or the bullyee? Is there common themes that you see?
Yeah. Well, I'm just going to look off screen because I have some stats that I pulled for you. It was actually from an American website called the US Bureau of Labor Statistics. And they quoted a survey by the Workplace Bullying Institute from 2017, which stated that nearly 3/4 of bullies in the workplace are men. And 60% of those male bullies target women. And that of the female bullies, over 2/3 of them target other women.
Wow, that is staggering. So there's definitely one gender that is being much more victimized here disproportionately as a whole. Wow.
Absolutely.
So in your coaching, how can you help a victim of bullying? What services can you provide, and how can you help their mindset when they're trapped in that environment?
Yeah, so I think you have to do a sort of initial assessment to see whether someone has, predominantly psychological problems like quite, fairly severe anxiety, depression, PTSD, and then I wouldn't say that people are really in the right frame of mind to be coached out of those sorts of problems. I think they need specialist mental health help with those issues. I think things like stress, fairly low level stress and low level anxiety can be helped with coaching. But also there's things like low self-esteem, low self-confidence, frank imposter syndrome or imposter phenomenon, as I've heard it called recently. Burnout, because obviously, there's a lot of things that are contributing towards burnout in general before the pandemic. But now there's even more, and bullying is just one of those things that will contribute to that. And then things like conflict, aversion, and people lacking in assertiveness. These are really things that arise as sequelae of bullying, that are all very coachable.
Absolutely. So what about if you're referred to coach the bullier? What can you do there?
Well, a little caveat: I haven't actually coached anyone who's been the bully yet. So it's a good opportunity, in preparing for this, to have a good think about that, actually. And I think one of the key things is that there has to be a certain level of insight on the part of the bully. There has to be, some kind of awareness that they are a bully, admitting it to themselves initially, before they can then admit it to like their coach or whatever other professional they're working with. And part of that is I do a fair bit of work on emotional intelligence and growth mindset with clients, and I think when you look at Goleman's frameworks on emotional intelligence in leadership, there's sort of five areas. There are definitely three of them that really jumped out to me that could help, if you worked on those, that could help people who bully. So self-awareness, so them being able to recognize and understand their emotions and be aware of the effect of those emotions on others. And then self-regulation, which was essentially expressing their emotions appropriately. Right. And for me, a spin-off of that, which is not one of Goleman's categories, but self-control. So, not having emotional outbursts that are typically out of proportion to the situation, So I think a lot of bullying is rooted in insecurity, especially when it comes from leaders. And when they're feeling insecure, because often they have low emotional intelligence, they feel threatened. And then that triggers the whole, amygdala is hijacked, and, the whole sympathetic nervous system fight or flight thing. So that's why I think they get angry in the moment, because they are insecure in their skills or knowledge or whatever. And then they feel threatened by someone in their team who may appear like they could be a better leader than them, or do a project better than them, or something like that. And then that's what kind of like leads to that, I think. So then the third of Goleman's things I thought was particularly pertinent was basically just empathy, so almost the reverse of self-awareness in a way. So being able to recognize the emotional states of others and then respond to that on the basis of, the data that's coming towards them there. But other than emotional intelligence work, I think a lot of, as you said, about mindset stuff, that's so vital. If you're insecure, where does that come from? Are there self-confidence issues? Are there other self-esteem issues there? Are they being contributed to by unhelpful thoughts like the inner critic and negative mind chatter and limiting beliefs and things like that? And mindset problems, is there an element of fixed mindset in some of these types of people? And that is very fertile ground for a coach to work on, as you know.
Absolutely. So how do you think it's best to educate the group that's most vulnerable to this, the trainees, the medical students, those that are going through the training process, whether it's in New Zealand, in the UK, or in the United States? What's the best way to get the word out of what's going on with bullying, what people can do about it, and what resources are available to them?
Well, firstly, I think it's a ubiquitous problem. From what I've seen, as you know, we been living in Australia for 18 months before we came to New Zealand, and we hail from the UK, and trained and worked in the UK system for like 19 years. I was a doctor in the UK before we moved away. Right. And then my experience of working with American physicians is what's informing me about what's going on there, and being in amazing groups with people like yourself, and learning from yourselves and learning what's going on in the States. So I think it's just horrendous everywhere, really. And the things that I went through were sort of 2005, 2006, 2008, 2009, that kind of period. I just don't see it having improved at all. And as I referred to before, I think the pandemic has sort of shone a light on it and almost kind of concentrated it. There's the other stresses that people are experiencing at work has lowered their threshold for being unkind and unsupportive and frankly horrible to their colleagues. And the sad thing is there isn't a huge amount of help out there. Right. There's lots of kind of wellness and well-being stuff being done, and you can approach like for example in the UK, there are lots of webinars being put on about it by the unions like the British Medical Association, and I don't know if that kind of thing happens in the States as well. And in Australia, there's things being put on by your indemnity insurance companies and things like that, because obviously, it's in their interest to help doctors who are being bullied, because that can lead to medical error and patient safety issues. So then, it's more cost effective for them to help. With the not the root cause, because they can't help prevent you from being bullied, but they can help you deal with it. But yeah, I mean, it's one of those things. It's part of my mantra, really, that that you're not alone. But unfortunately, it's one of those subjects that it's so stigmatized still. We feel you just feel like weak if you admit to being bullied. And there was that article from I'm sorry to talk just about doctors, but there was an article in the Journal of the American Medical Association. It's pretty old, but I think it's probably still just as relevant. It was from 1990, and it said that about 46% of medical students in one particular med school in the States had experienced and reported bullying. And following that cohort through, by the time they were attendings, that figure had risen to 80%.
Wow. Staggering.
Yeah. So imagine if you are walking along the hospital corridor and you pass 10 fellow attendings.
Right.
It's possible that 8 of them have also experienced bullying. But opening that conversation up is really difficult. It's really challenging. So, I mean, yes, there are, mental health services that people can approach. And, some of the medical organizations are putting on, webinars and things. I myself was involved in delivering a webinar for the practitioner health program in the UK a few weeks ago. But, it's hard to raise awareness, especially when the organizations themselves won't admit there's a problem. This is the thing. Yeah. Some of these high-flying, Ivy League organizations where it's just as much a problem as anywhere else. They're not going to admit to it, because they're not going to get people applying for their amazing programs.
Sure.
So
in Australia, I believe one of the surgical programs was shut down for bullying for 18 months last year.
Yeah. Yes.
And you don't want to be on the front page of the Sydney whatever.
no, Morning Herald or whatever. Yeah.
Right,
Yeah. No,
right.
You're right. You're absolutely right. And I feel that in Australia it's particularly bad, and there are other reasons for that. Sort of, I think there's some kind of financial issues around why some doctors are more toxic than others.
So if we were going to look at the perfect dream world 5 years from now, what could we move 1%? What would it be if you were in control?
Do you know what I think would really help? It would be encouraging 1% more of doctors to speak up about it, to admit that they're being bullied, and seek refuge, if you like, in the experience of others. I think that would be so powerful. Even now I'm thinking in the future of I would like to run group coaching sessions for people who've experienced this problem, but getting doctors to admit to it and then speak about it in front of others, I think is going to be pretty challenging until we sort of remove that stigma. But the only way of doing that, I think, is for more and more people to start speaking up about it.
Absolutely.
And making the others realize that they're not alone, that it's very, very common, that they're not to blame. And I guess on the flip side, it's, could we get 1% more of bullies to admit to themselves that they're bullies?
That would be interesting. That would be fascinating to see how we can do that.
Yeah.
So we'll need some sort of bullying quiz that everyone has to take once a year to see what their score is on the bullying score, to bring some awareness.
Yeah, you're right. Why not? I mean, we have surveys and inventories and questionnaires for everything else, don't we? Resilience,
we certainly do.
And, so maybe you and I need to put our heads together and create a bullying inventory.
That sounds good. Sounds like we won't have a lot of clients chomping down the bit to get it, but it could be revealing.
It'll be a slow burner.
Yeah. Those that are introspective.
Yes,
so how can people reach out to work with you, Dr. Harrison?
My email address is dr.adam@coachingmentoringdoctors.com. So it's a bit of a long email address. And I have a Facebook page, which is at Coaching Mentoring Doctors. And as you know, I now have a YouTube channel.
Congratulations.
Thanks so much. Yeah. And to you, which is just Dr. Adam, physician coach. And I'm on LinkedIn as Dr. Adam Harrison. I'm very active on LinkedIn.
Yes.
So, yeah.
Absolutely. Well, if you think Dr. Harrison can be a benefit to you, you've experienced bullying, and as he mentioned, 80% of us have. So don't feel like you're alone. Don't feel like you have to figure this out. You are a human. If you're a human physician anywhere on the planet, you've experienced this, most likely. You don't have to suffer alone. And it's really possible that working with a coach like Dr. Harrison could set you free from at least mental extra that's going on in your head. So thank you, Dr. Harrison, for spending some time with us today.
Not at all. My pleasure. Thanks so much for having me.
All right.